This video is from a 9-year-old golden retriever with an intestinal obstruction due to a tumor. The lesion is seen as a dilated, atonic, ingesta-filled intestine, typically found proximal to the obstruction. This ingesta-filled intestine looks like colon and shows edge shadowing, but does not show acoustic shadowing typical of colon, nor is it in the expected location of colon. Follow this intestine to the obstruction. Compare to the appearance of colon. With intestinal obstruction, there is usually a history of vomiting. Intestinal loops proximal to the obstruction will be filled with fluid and/or ingesta. Fluid and/or ingesta will stop at the obstruction or foreign body. In this 40-pound mixed-breed dog, a cloth foreign body absorbs the entire ultrasound beam, resulting in an acoustic shadow. Intestinal loops distal to the obstruction will appear normal and empty. This dog also had intestinal perforation and a severe septic peritonitis. This video is from an 11-year-old Rhodesian Ridgeback presented for vomiting. The video shows a hyperechoic mass inside of an intestine, which is inside of another intestine. The mass has an acoustic shadow and looks like colon. It was part of a plastic toy. The ultrasound beam is rotated to a long-axis view of the intussusception, showing one intestine telescoping over another intestine. Intestines proximal to the obstruction are filled with fluid or ingesta. Intestines distal to the obstruction are empty and appear normal. Intussusception can be a cause of intestinal obstruction. It is often associated with foreign bodies, intestinal neoplasia, parvovirus enteritis, FIP in cats, or other causes of severe enteritis. About 50% of intussusceptions in cats are related to GI lymphoma. In this short-axis image, the arrow points to an inner loop of intestine telescoped inside of another part of the intestine. In this short-axis image, the arrow points to the mesenteric fat of the invaginated intestine. An intestinal torsion interferes with blood supply to the intestines and can cause vomiting, rapid deterioration, and death of the patient. Consider intestinal torsion when enlarged blood vessels are found but cannot be clearly associated with a major abdominal organ, such as a spleen. Blood vessels may or may not show color with color flow Doppler.